Okay, we are live, and I have Dr. Mansi Oza in the house, a dentist, a fantastic dentist that I've had some great experiences with here over the last year or so.
Mm-hmm.
And we're going to talk about your technology that you use.
Sure.
We're going to talk about where dentistry is headed,
Mm-hmm.
where it's been. We're going to talk about all these fun things because, I didn't like to go to the dentist for the longest time.
I don't either.
For the longest time, I didn't, and then you were right here in Thurmont. I'm in Thurmont, beautiful little town. I said, I've got to try out this dentist. And I checked out your Instagram and so on. Oh, by the way, let's show your Instagram. Oh, we've got it up there. Let's bring your Instagram up. I'll get a couple of these banners off out of the way. And so follow this young lady on Instagram because she's posting on there just about every day. And it's Thurmont Smiles. Thurmont Smiles is the Instagram. So there you got
share a lot of tips there.
Yeah, you got a little look there. And so I wasn't really that excited about going to the dentist, but I did finally go. And then you did a full examination and gave me a roadmap because I had neglected my teeth. I'd let them go. And you gave me a roadmap, and we've been following that, and it's really going great.
It's
awesome. Really going great.
That's
I'm
awesome.
Even flossing pretty much every day, which I hadn't
been,
I hadn't been doing. Okay, and so your hygienist, your assistant showed me how to do that and all that, and I'm doing a better job at that. You have taken out. Well, first of all, I had a broken tooth, and so you fixed that.
I did.
And let's, before I go on to the other things, let's talk about that machine and how the process that you did for that. That was a partial crown. Is that what that's called?
Yep.
What was that all? How did you do that?
So basically, the technology we have in our office, there is nothing like that anywhere else. And it is called CEREC, CAD/CAM technology. Basically,
and it's that machine that we've got up there.
So what you're looking at here is a milling unit, and what I did in your mouth was that we scanned the tooth first. The goal we have always is to preserve as much enamel as possible, and this machine and technology lets me do it because I'm designing everything right there. So we scan your tooth, and we, instead of removing all the enamel all around, we were able to preserve about half of your tooth. So only half of it is a porcelain onlay, as we call it, or a mini crown. We usually do porcelain restorations when a tooth requires more help with the structure. If the structure is broken and the filling cannot hold, then we need to cover the tooth. Think of it like a helmet.
Yeah.
And traditionally, it used to take me about 3 weeks to about a month to get it back from the laboratory. And you would have a temporary, thank you. You would have a temporary crown, and which is a pain in the neck. I had it myself.
I've had them fall off.
They fall off.
Yeah.
Their tooth gets sensitive, or it can get infected. The gums can get infected. And you're constantly worried. And we did that too before we had the technology. And patients always came back with so much inflammation, and it didn't give me.
And this one, you made it with that machine while I waited.
Yeah. And you wanted to know more about it, but some of our patients don't, and they just lay back and they watch Netflix, and while I'm working and the machine's working, and it's just getting ready.
And correct me if I'm wrong, but you're able to get a more precise fit and really do the job right because that machine is right there, and you're doing the designing and the fitting and all that right there.
Yeah, because I don't have to rely on anyone else, and I can zoom in and I can enlarge the tooth about 90 times bigger. So I'm looking at each and every nook and cranny. I'm very detail oriented, and it really bugged me when I had to give that control to someone else, because
an independent lab, and then if they send it to you and it's not correct, you
have to Yeah.
Yeah.
I went through that. So that's why I bought the technology. I realized how hard it is for the patients.
And that was really cool. We got to do a video showing that actual working
Absolutely.
to have
It's amazing.
available. Let me check the comments real quick, and then we'll talk about the rest of the things you did on my teeth. Oh, that's okay. Here we go. All right. Hello. I am Christine. Please. My name is Efren. I am Christine. Please. Okay. We can help you. Come here if you need your teeth fixed. We can help you. Absolutely. How are you? We're doing good. And let's see. Oh, the same person here. Okay. Wait for you, please. Okay. We can help. Absolutely. Thurmont Smiles. Travel. Hey, she's a destination dentist. You can travel from anywhere in the world and you can come here to Thurmont, Maryland, a nice little town, and she will take really good care of you. And the benefit of you doing a lot of this in-house right there is you can do a lot of work even in just one visit.
Everything, like any porcelain restorations that are needed, we are able to do it just in one visit.
Wow.
Yep.
That is absolutely amazing. Okay, so let's look at a few of these before and after photos. Well, first of all, I'll tell you what, we're going to start from the top so we don't miss anything here. Let's look at this picture here. Advanced Dentistry. What's that machine right there?
So this is a Cavitron unit. Our hygienist, and by the way, she's top notch, very gentle. There is no one like you have had cleaning done by her.
Great
Your
job.
Gums don't hurt, right?
Great
Afterwards.
job. Yeah.
So this helps her because it kind of vibrates. So it can go underneath your gums, not too much. We don't want to hurt you, but it can very gently clean all the plaque and tartar, even stains. And the numbers that you see, we can change those numbers based on the intensity. She usually keeps it on very low, but sometimes some people have lots of stains that are not coming off.
And so she can turn it up as needed.
Yeah. So it really helps with gingivitis or any gum infection treatment. We can thoroughly clean the teeth and remove all that infection and inflammation.
Super. And there's your building.
Yes,
and
beautiful.
nice state-of-the-art offices and everything. And there are plenty of parking, so no issues with any of that. And so what do we have here?
So that's the machine that we were just talking about. So on the right side where you see that computer screen, that's the scanner. So it is so precise that even in like micromillimeter precision, it can design everything. I design everything, and we are continuously evolving too. So it is now coming next year, we'll be able to completely duplicate someone's denture, and we can scan it. So there's implants and implant crowns. We can make guides. So we are precisely putting the implants in someone's mouth.
Wow. So
on the right side, what you're looking at is a scanner. And on the left side, the blue color is the mill that you just looked at. So after I design, it digitally, we transfer the design to that mill, and it is able to mill the crown from a porcelain block.
Wow, that's amazing.
Yep. And the other two orange ones that you see, it's like an oven or a furnace, and it hardens the crown to its maximum strength. So
oh wow.
So it does not come off.
This is amazing. This is amazing. And that what are we looking at here?
So what you're looking at, the 4 gray holes that you see there, that's where the implants were placed. So this was done for a patient who did not have any upper teeth, and she did not want any removable dentures. So this is called all-on-4 dental implants. So meaning that all the teeth are supported by 4 implants. And you can see how small we were able to make it. It almost feels like natural teeth, and you don't need 1 implant for each tooth. We are able to create all teeth on just 4 implants.
So that is basically bolted into the mouth.
Correct.
Screwed into
it is
the
screwed
mouth.
in. It doesn't come off. Yep.
Wow. And how long do those hold up?
Forever. This particular patient, she is very clean. So it requires teamwork, right? The patients have to do their job. We have to do our job.
But they'll last a long time.
They last a long time. We do have to clean them after a few years. But they're amazing. Yep.
And let's see here. Invisalign. So that's like these invisible braces that help straighten up your teeth and all.
Yeah.
And do you design those and put those in like right there in the office? How does that work?
No, this one takes some planning. So we are able to scan the teeth with the scanner that you just saw. And then before you even reach home, we are able to email the scan. So your existing teeth the scan of the existing teeth can go straight to the laboratory. And then I communicate with the laboratory. We design your smile. Then you come back, or we can do a Zoom call or something, and you see the final outcome.
So this one does require an outside.
A few visits, yeah, correct.
Gotcha. Okay.
Correct.
But they're well known, and that works well. And then there's a dental laser.
So the laser, we are able to do a lot of soft tissue procedures. So like if someone's lip is attached and they are not able to speak properly, or if they have gaps in their teeth, because of that attachment of the gum, we are able to safely remove it. Many times there is no anesthetic that's required, and there is absolutely zero bleeding.
Wow.
So yeah.
And let's go back to the comments here real quick. See what we've got spooling up. And Derek is in the house, and he says hello. And let's see. We're getting a lot of comments from this gentleman. Okay. And is Waterpik better than regular flossing?
Well, you have to use both. So people like to use Waterpik just because, I don't know why. I do too. It's kind of more fun than flossing. But Waterpik will remove the newly formed plaque, whereas floss will remove even older plaque. Like if it's been a few hours, then the floss will remove it. So I personally use both.
Do both.
Waterpik probably in the morning and floss in the evening. They both touch different areas in the mouth, so you want to use both.
Okay. And BriFitDance is in the house, and she says hello. And Kevin is in the house. He says, thoughts on Mercury fillings?
So, and if you have any specific questions, so at Thurmont Smiles, we are completely mercury free and mercury safe. And I'm actually SMART certified. It's abbreviated. It's called Safe Mercury Amalgam Removal Technique. So anytime you brush, you have hot liquids, you grind your teeth, the mercury comes out of the fillings. And there's a lot of research that is showing this. So we remove the mercury filling safely, meaning that we have a vacuum a filter very close to your mouth. We cover the teeth with a rubber sheet so you don't swallow or inhale anything. We put oxygen mask on you so you're not inhaling it. My assistant and I are completely covered, so nothing's getting on us either. So it's a technique,
and I've been through the process.
You did,
and you did a fantastic job. And I'll tell you, the finished teeth, and you still have a couple more to do. In the next visit, but they look gorgeous. They look a lot better than they did before. And by the way, if anybody wants to come in and join the video chat with the good doctor here, let us know in the chat if you want to come in and ask a specific question and be part of the show. And let's see what we have here. That's one we just saw. And let me go back here and catch up. We already showed this photo here and talked about the machine. That is awesome. And then you've done some work for some of the title holders. I guess that's Miss Marilyn there.
That's Miss Marilyn. She's so sweet.
You've done some cleaning of teeth and some whitening and all that.
Yeah, she wanted her teeth nice and bright, and we used our light technology. So just in one visit, we were able to go 5 shades lighter, and then she was able to continue at home to continue whitening.
So quite a difference even in one visit.
Absolutely.
And then
it's
it
amazing.
Continues from there. Okay. Wow. Amazing. Okay. And then here's a before and after, where obviously big improvement in the smile there.
Absolutely.
And then
it's life-changing.
Here's another before and after. And yeah, the teeth are really important. And like I say, I've let mine go, and I haven't really wanted to do straightening or have the gap that I have filled, because they work, they function, and I don't want to risk
That's right.
messing something up.
And that's completely fine. So if you are okay with yourself and your main goal is health, that's awesome. We can help with that.
Yep.
But we have so many patients who are crippled by their smile. They don't smile, they don't laugh, they don't
And there
eat.
seems like there are a lot more
So
options now.
there are so many options.
And it's gotten better.
Yeah.
Yeah. Okay. And so let's see. Then here's another one. And then, wow, quite a transformation there. I mean, it's amazing the work that you're able to do.
Thank
And
you.
then there's another example, and you've got a bunch of these also on your website. So yeah, we did have let me check the comments here and see if we've got anything else in here. The Mercury phones. Okay, we're caught up on that. We did have Brianna actually asked. She's a regular here, and she's actually helping me with some production work and so on. So she asked about her teeth. Let me see if I can put that picture up. Here we go. We got two here. We got a wider shot, and then here's a closer shot. Okay.
So good pictures.
And so with teeth like that, what would be your approach? Obviously, you can whiten them. What else would you do in this kind of an example?
So we base our smile makeovers, if you will, or any kind of cosmetic treatment on oral wellness. So the first thing we do is we want to make sure that her foundation is good. Just like we did for you, and we are always evaluating things, and we are always improving also. So we check all of the teeth, including the molars. The patients who come to us with the front teeth, they want to improve their cosmetics, which anyone can do. But if it's not based on the function, then everything will fail in short term.
Okay.
So we start with the pH of the mouth, make sure they are not acidic, because any work that I do, they'll start getting cavities again. And we don't want that. We want it to last for a lifetime.
Okay.
So I need to see her, but basically just by looking at these pictures, her teeth are already beautiful. Based on what bothers her and what her goals are, maybe it's the bottom tooth that is slightly out of the alignment.
So would that be something like Invisalign or something like that?
This is really easy to do as long as her bite is strong and good, and she doesn't have anything else going on. Invisalign is a very easy way to fix
and the
this.
whitening them.
Yeah. Yep.
Okay, and we're going to talk about that some more also. And okay, so let's see. We've got our wags in the house. Let me get this picture off. Okay. Do you recommend teeth whitening at the dentist? Thinking about doing it, although I use Crest white strips.
I do recommend teeth whitening at the dentist. We are actually very known for our teeth whitening. If you joined us earlier, then you probably saw Miss Maryland and even Tiffany Franco-Smith from TLC's 90-Day Fiancé. They all wanted to whiten teeth at the dentist at Thurmont Smiles. So I do recommend that, and it's because it is safer. So all the products that we use are researched really well. They are safe for you. They will get you results, and it also helps me evaluate your teeth first before we start any treatment to make sure you are not doing any harm to your teeth.
Now, I'm a little old school, and you don't get something for nothing. What is the downside to whitening the teeth? Is there a downside?
So nothing, actually.
If it's done right.
If it's done right, correct. Basically, it's it's a strength.
Well, I guess what I'm asking is, can you bleach and do it to a point where you're actually taking off some of the good part of the tooth? Are you?
No, you are not really taking it off unless you are using any harsh toothpaste. I see that a lot in the supermarkets. They are charcoal toothpaste and whitening toothpaste, and they are really
That's
not
a problem.
Really, yeah, that's a problem. But if you are doing it in a controlled environment where good products are used, then it's not harmful. It's basically going deeper and removing all the stains from the teeth.
Okay, so we're going to talk about this some more. Okay, so matter of fact, here's a follow-up question. Probably one I would have asked what's the cost of teeth whitening? You have a couple of different levels and plans.
We do. So we start at 79 and it goes up pretty high. It is based on your basic shade and your desire, what shade you want to achieve.
Okay, so here's the follow-up question. It seems obvious. How long does it last? Okay, I have my teeth whitened. Let's say I don't smoke. Let's say I don't drink coffee. I don't know what else you wouldn't want to do, but let's say you give me the advice. This is how you got to take care of your teeth. How long does the whitening last, and can it be done again? Let's say it lasts. Well, first of all, let's start with that question. How long does it last?
So it depends. So if we have a system called deep whitening, and it actually goes deeper and whitens everything, it is considered permanent. Now, that being said, if anything can, if you are consuming foods that can stain, any white T-shirt can stain the teeth.
Let's get some examples of that.
The foods,
coffee,
wine, anything,
wine.
any darker.
Okay, I don't drink wine. Okay.
So if you have used our deep whitening system, then all you need is some touch-up gels, and you have done the entire system. So every 6 months or so, you just need one gel, and you whiten for 2 days to up to a week, and you're back to where you were. So
I might have to experiment with that. We might have to try that out and keep the people posted here on the channel how that whole thing goes. Okay, so I'm trying to think what else on the teeth whitening. Oh, okay. So you said there's really no harm in doing it. You're saying that it lasts and you just need some touch-ups later. My goodness, I can't think of why people wouldn't want to do it. I thought that you're like kind of bleaching the teeth or whatever you're doing. I thought that was kind of like harmful to the teeth.
No, if you do too much, or if you already have, if you are doing it yourself without guidance,
and you're not doing it right,
if you're not doing it right, or if your teeth already have some issues, then you want that addressed first.
Okay. Let's see here. Is it better to drink coffee or Coke with a straw?
It's better to drink water. That's what I always say.
Sorry, our wags, you're just gonna have to give up the Coke and the coffee if you want that movie star smile. By the way, he's a very handsome gentleman. He is. We were talking about destinations. He traveled from, I believe he's in Indiana, something like that. Wow. And he came to one of Steve's live events, not live, one of Steve's in-person events at Little Treasury Jewelers. He traveled all the way over to come to that event. And he was one of the folks that came and just had a great time. And Steve is having another one this fall, and I'm pretty sure our wags will be there. So I can see him traveling to get his teeth done.
Absolutely.
If he would travel
to
see Steve, I can see him traveling to get the teeth done and get it done right. Ballpark cost of the filling removal. This is the Mercury thing.
It depends on how many surfaces. The cost of the filling is usually based on that. And again, we also need to see the mercury fillings, because it is metal, it contracts and expands, so it causes a lot of cracks underneath the teeth. So as long as the tooth structure is good, and if it's just one surface that we are replacing, it would be close to 150 something. Don't quote me on numbers. I'm pretty bad with them, but yeah.
But I have to say, I mean, it sounds like there's a whole bunch of reasons to do it, because do you get around that problem of the expansion and contraction and cracking and all? Is that problem solved once that's gone?
Not really, if the cracks have already developed.
Well, let's say you fix that. Let's say you take out the filling and you fix whatever cracks, and then you put in your thing. I guess what I'm asking is, does your filling have the same problem with expanding and contracting?
No, it doesn't. It's actually bonded to
So we've solved that problem,
Correct.
basically. Okay. I like problems being solved.
That's
okay. Good. Can dentists prevent receding gum lines?
Yes, we can, by guiding you. So we want to again find out what is causing the a recession, right? So it
Mhm.
could be, you could be grinding your teeth, and if you're grinding your teeth, then why are you grinding your teeth? Is it because your airway is narrow? Maybe that needs to be checked, or maybe you are using very hard toothbrush, and that could be causing that. So we want to look into that. Sometimes it is vitamin deficiency. So if you're not eating greens, then I would start incorporating that, especially vitamin K. It's really important for
Now, can we get
strengthening the
vitamin
bones.
K from spinach?
Yes, all the
Good.
greens. Yeah.
Good,
Yeah.
good.
Yep.
Okay, so our wags again, Chip. They call me Chip sometimes, even
Okay.
though that's not my name, but they just do it. You and I need it done, being in our 6th decade. Well, thanks for letting the cat out of the bag there. Yes, I'm scheduled to have my whitening done on Thursday. I will let you know how it goes. Yeah, get the real deal though, our wags. Don't get their basic package. Get the real
Yeah, if
deal.
you want results, you want the best.
Get the stepped up deal.
Yep.
Well, he can afford it. Okay, so let's do a time check here real quick. This time check is brought to you by Little Treasury Jewelers, folk. Little Treasury Jewelers. That's right. Get yourself a diver watch just like that one right there, or get yourself a gold stunner like this one right here. You can get those
It's
at Little
beautiful.
Treasury Jewelers. Oh, by the way, this is a model SBGY002.
That's really
That's
good.
what that is, and very few people have seen one of these in person. And so we need to get your impression of that timepiece since you're seeing it here in person. What do you think?
It's gorgeous. I think this could be a very good Father's Day gift.
A very,
Yeah, right. It's coming up.
very good Father's Day gift. There you go. If a young lady is watching this and you want to buy that for your dad, that's what you do. Get yourself a Grand Seiko. Okay, so let's see. Deluxe Whitening. So he's getting the Deluxe Whitening. Okay, that's probably that one you have that does
We
6
actually
shades.
we have the platinum. I'm just kidding.
And you do 6 shades the first go round, and then they do some more shades.
Yeah, so it depends. Everyone's teeth respond differently.
Mhm.
Again, it starts with what their base shade is,
Mhm.
but I have never seen anyone not lighten their teeth with her systems.
Okay. Well, there we go, folks. So maybe we'll do a test. Maybe we'll do a test at some point. But we couldn't do that live. That's not something we could do live.
Yeah, we could. If you are brave enough. I can do it.
Let's see here. I'm trying to think what other. Let's go make sure we. Oh, could I join to discuss my teeth situations? Absolutely. Absolutely, BriFitDance. Feel free to come in. And I will go ahead. I'm going to actually put the link in the chat here, just so that it's handy for whoever may be watching, including you. And absolutely come in. And that's what we have the dentist here for. Now you notice when I posted that, it automatically posted it to all the different feeds.
Oh yeah.
Okay.
You're very tech savvy.
So there you go. Well, you know that the funny thing is this internet thing, about 20 years ago, now more than 20 years ago, when I started Frederick.com, I was very, very pro internet. I thought the internet was going to be a thing.
Mm-hmm.
And I was trying to convince people, and I signed up a bunch of businesses as sponsors initially. And some of them, most of them didn't have a website at all at that point. And so we put them all on Frederick.com. And some of them got it and some of them didn't, and so on. But I'll tell you, even years later, I've learned that business owners are focused on their business.
That's right.
They don't
There's
have
so much
time
to do,
to
right.
focus on the internet. And it's taken me a long time to learn that. And so I have to try to do as much as I can to help them leverage the internet, but at the same time understand that they're busy people.
That's right.
And that the reason they're successful in the first place is they're focusing on their business.
Right.
And so, we just do the best we can.
Yeah, that helps.
Let's see. What's this one? Do you recommend adults having fluoride applied regularly?
So yes, if your goal is to get less cavities, fluoride does help. Some people believe in it, some don't, but we do offer it to our
Do
adult
you do it
patients.
with that? I have that annual thing for you with you. Does
Yeah,
is that included in that?
It is included
There we go.
twice a year.
That's a really good deal.
Yep.
That annual deal that I've got is Prevident. Prevident. What's that?
Prevident,
Is
yeah,
that a
it's
brand name?
toothpaste. Yep.
Useful for sensitive teeth.
It is. Again, you want to find out, make sure you don't have cavities causing sensitivity or gum recession, but it is useful, yes.
Business owners work in the business, not on the business.
That's right, Jaden.
Okay. All right. And so we have a guest here in the green room.
Hi,
We're going to
Bree.
bring in Brianna. Hello. How are you?
How are you?
Hello. Good. How are you? Nice to meet you.
Good. And folks, let us know in the chat if you get any feedback, because I've got Brianna on speaker here, but I think it's going to be okay. But let me know in the chat if you hear any feedback at all with her feeding back into the mic. So
yeah, because the audio,
and I'm going to turn it down as far as I can to where we can still hear her.
The output is on the
Bree, Bree, we can hear you fine. What do you think? What are your questions for the dentist?
Yeah, so I would like to know if I could get my teeth whitened some more, and also see if I could like fix my crooked teeth at the bottom.
Absolutely, that's easy peasy. Easy for me to say, I know, but no, it is relatively pretty straightforward. I need to check everything, but yeah.
They're okay, but I want it to be like perfect. You know what I mean?
Yeah.
For video.
You have a
She
beautiful
wants to
smile. We
have-
can just enhance it a little bit.
She wants to have that movie star smile.
She looks like a movie star, so why not?
So why not? Thank you.
So what dental work have you had done in the past?
I actually had my teeth whitened, but it came to a point where it was like too sensitive. Like it was like an hour, I think. They had like a whole, I don't know what it was, but I think it is Invisalign. And it was like a sensor that whitened my teeth for like an hour. And they wanted to know, they were asking like, can you go more? And I was like, no, it's too sensitive for my teeth.
So it was feeling, it was feeling, you felt it. It was not pleasant.
No, not at all. I mean, the first like few minutes, it was okay, but then it got.
So what do you think was happening there?
So I think they applied too strong of a gel too quickly and with intense light. That's what it sounds like to me. So we actually, when I bought the practice about 8 years ago, we had a demonstration done and my assistant had the same experience. And ever since, I never bought it. So it is just that it does.
So you just don't even use that same system?
No. Because of that, I've heard they have improved things, but the reviews are not good. So we really base our products.
You have a different system.
Yeah, we have like 4 different systems, and we don't have that issue at all with her patients. Or if you do, some patients are different, then you kind of want to space it out, and it works. So.
Okay, cool.
And so RWAG says the audio is looking good. Blue says good audio, and Dr. Mansi is awesome.
Thank you, Blue. You are awesome too.
There you go.
Nice.
And so, maybe we should do something. Maybe we should do some kind of a live thing. Not live. I think it should be a produced video so we can get really good close-up shots and so on. Maybe we should do something showing that process, or would you be giving away too many trade secrets?
No, there are no secrets.
Try to do a story about
the secret is me. I cannot be duplicated.
Okay, and so maybe at some
that'd be
point,
cool for a video showing.
Maybe at some point we should do something like that and see if we can show like a transformation of her teeth.
Yeah.
Because I think if it was really well done, with really nice camera angles, really nice shots,
Yeah.
and tell the story clearly, succinctly, tell her story, why she wanted it, you know, not just a before and after picture, a whole story around it, right?
Mhm.
I think that there's a lot of people in her age group and beyond that would see that and could relate to that.
Absolutely, yeah. People want to see, and once they see how comfortable you are,
Yeah.
they can. I really that was the purpose of this live for me. That if I can reach the people who really need my help, then I would be happy, because we know we really can make a difference. So
Yeah, well, my goodness, just the before and after pictures that we've shown already, and so
Pictures are really
let's
good.
show Bree's photo one more time here. Let's show her teeth one more time, and so you think a little bit of straightening on those bottom teeth,
Yeah.
and is there anything you would do to kind of even out the top teeth a little more, or is that something that you'd have to go too far to do that?
when we do Invisalign, we can even them out. This is how the natural teeth look, though. I mean, I have a dentist eye, so I'm always finding things that are that I can tweak. But her teeth are actually pretty nice. It's the bottom tooth that is not in the alignment.
So you think the
Right.
end result would be pretty amazing?
Absolutely.
Okay.
Yep.
So would I
Wow.
need braces, or what would I need for them to be straightened out?
Yeah,
Most
let's talk
likely,
about the Invisalign, how that works.
most
Yeah.
likely you could be a very good candidate for Invisalign, as long as your back molar bite is good. But looks like you could.
So really, they almost wouldn't see them. That's why they're called Invisalign.
Correct.
Is they
Correct.
wouldn't even really know you're wearing it, Bree.
Yep, and we have samples that you can see at the office. So they are basically just plastic trays that pop onto your teeth, and at a social distance, you cannot even see them.
And you pop it on, and then your teeth slowly move over time, and then you
Yeah.
pop another one on, and then that
You
keeps
change
kinda
them
doing it?
weekly. Yep.
Okay.
Oh, okay.
Yep.
Okay, and then over time, it just kind of pushes them into place.
Yep, and it does it so gently. Like when you change it the first time every Sunday or whatever, you feel that the tray is little bit tighter, but that's it. Doesn't hurt like traditional braces. You are still able to brush and floss, which is big for me.
Now you take
So-
them off and do that, right?
Yeah,
And
you
then put it
take
back
them
on.
off. Yep.
Okay.
And how
And does
fast
she
it
sleep
works?
with them on too?
You do, yeah.
Okay.
You want to wear it for about 22
all the
hours
time.
a day. All the time, pretty much. You are removing them for brushing and flossing and eating.
Wow.
Yeah, I'm doing my best to not stain my teeth. Like I don't drink coffee or anything. Just my water. I always have my water.
Awesome. Good job.
Like, yeah, always.
All right. Well, thank you for coming in. Do you have any other follow-up question for the good doctor?
No, I think I've gotten a lot of information, and I would like to see you for, like, to inspect me, I guess.
Absolutely, anytime.
Yeah, we have to explore this possibility of doing a documentary, because we need somebody that is willing to go through that whole process.
Correct.
And the average customer of yours may or may not be willing to go through that whole process.
I would like to. I'm volunteering.
And you will help a lot of patients, so
There you
feel
go.
good about it.
All right. Well, we'll see what we can do. Okay. Thank you for coming in.
Thank you. Thank you.
Brianna,
Nice
and
meeting you.
her brand is BriFitDance.
you.
She's all into fitness and dance. So that's a good thing. Fitness and dance. Okay. So let's look at these comments here, get caught up, because we're at 5:38. Let's see. Craig, you've got to video your whitening with a yeah. Well, we I think we have to figure that out.
Yeah, we'll do that.
Absolutely, we have to figure
He's
that
saying
out.
you have to do it too.
Yeah. Oh, absolutely. I've got to get the whitening thing done. Yeah. Okay. So my bottom 4 teeth are crooked. Well, Invisalign
is great.
Invisalign blue. Yeah, absolutely.
Pretty straightforward and relatively easier.
Sounds like a good time to make a road trip to Thurmont, Blue. Let's see. I assume Invisalign would be good for me as well. There you
Sounds
go.
like it. Yep.
That's right. that's the way that works. Wow. We've covered some good ground. Let me go back to the brand here and make sure that we don't have anything that we've forgotten. So we showed that. Oh, here's the picture of you.
Yeah,
And that's in your
me.
wonderful, you've got a real nice waiting area there, and you've got H2O that they can drink.
Yep.
And then you have, do you have Wi-Fi?
We have Wi-Fi. We really want to make the visits as comfortable as possible.
Okay.
So, yep.
Yep. And then let's see here. We've got a couple of testimonials. Which one would you like to show? Which one of these testimonials?
They all are good. And we have a lot more posted on our Instagram and Facebook too. But let's do the top right one.
Okay.
Just had a crown done, one visit. So I didn't have to come back multiple times to, have a temporary put in. It was, just a painless visit. It was one of those things where you come in and they're able to scan your mouth and literally create a tooth before you even leave the office. It was a great experience.
Okay. All right. And so let's see. Oh, I had the picture on. So I got to take the picture off. Okay. All right. But you didn't show the tooth.
That's right. We'll show it. We'll show
Okay.
it. We have lots of teeth everywhere.
Okay. Now what's this one here?
That is our smile makeover.
Oh, that's the gentleman that won. Yeah.
Yeah.
And let's see. And you got Miss Imesville.
Mm-hmm.
We could play a little bit of that
Hey
one.
everyone, it's Miss Imesville's outstanding teen, Riley Jackson, and I just got my teeth whitened by Thurmont Smiles, and I'm so excited because look at my teeth. They're super white, and I'm all smiles today.
So there you go. It's a whitening thing. Okay. So let's see. We got another comment here. I like the way it bolds it and it shows we've got one here. Okay. I'll make a trip to Maryland, get my Hoffman sub, and visit Dr. Mansi. Well, there you go.
Absolutely. We'll make you happy.
That sounds like a good trip. Have you ever had a sub from Hoffman's Market?
No, I haven't.
It's not exactly health food, but
Okay.
occasionally you nice roast beef sub.
Mm-hmm.
He makes the roast beef there. He bakes it there and he slices it thin. It's tender as could be.
Wow.
He's got a fantastic roast beef sub. Of course, a cold cut sub. They make them all right there.
I'll have
It's
to
that
try.
little market right on 77.
Gotcha.
Yeah, and I don't know how much longer it's going to be there. He's up there in the years.
Oh, okay.
So if you want to take advantage of that, you probably need to do it sooner rather than later.
Probably take my team too.
Place has been for sale for a long time. They haven't been able to sell it because nobody wants to work that hard.
Mm.
He works all day.
That's sad, yeah.
Yeah. He works from the wee hours of the morning to, right up to the evening. So Hoffman's Market. I'm trying to think what else we need to cover here while we have you. Let's go back here and make sure that we haven't missed anything important. Let's see, we talked about that. Trying to think what else. Now, this implant, okay, so this is like a whole thing. And then, of course, if you just have one tooth, that is a serious issue. There's, of course, the crown is an option. And then I guess in some cases, you just can't do a crown. There's just not enough
structure left
of the tooth.
Yep.
And so that's where you have to take out the tooth, right?
Correct.
The whole
Correct.
shebang.
Yep.
And then how do you put an implant in? How does that work?
So dental implant is basically a man-made root, right? So we have to again plan it out. If the tooth is not salvageable, then we remove the tooth. Usually what I like to do is that while we have the opportunity, we put some artificial bone in there. So whenever a tooth comes out, if we don't do anything about it, the bone that is holding the tooth will start to shrink.
Okay.
And then in future, if you don't, if you want something done there, you don't have enough bone, and then it becomes very invasive and expensive. So the process for implant is that the tooth comes out. We put some bone in there. Think of how if you were to plant a plant into the soil, you
Mhm.
want more soil there. It's just like that.
Okay.
And
And
then-
so you've got basically a hole there where you've taken the tooth out and
Mhm.
you've taken all the way down to the root, the whole thing out.
Yeah, we had to take the whole
Okay,
thing out.
so in the past, wouldn't they normally send somebody to somewhere else to have like a root canal? Isn't that what that's called?
Yeah, I mean, my goal always is to save the tooth because we cannot mimic the nature. I'm a big believer in saving what we have. But if the tooth is cracked down to the root, or if there's a lot of infection that's spreading to your body, it's not a good idea.
You have to
keep
take
it
that
there.
out.
We have to take the whole thing
But
out.
But do you do that yourself in house?
Most cases, yes.
Okay, wow.
Unless it's very complex or the health is not good.
Okay, so you can do most of it right there.
Mhm.
And
Yep.
so you take that out, and so then you put some new artificial bone in there,
Mhm.
kind of around the area. You don't fill the whole thing in, right? You just kind
We
of put
do.
some
No,
around.
we fill it.
You fill the whole thing
Mhm.
in with the bone, and then you can mount the new.
Yeah. So sometimes we do the implant right there and there, or sometimes we let it heal. My approach is to let it heal so we have a solid foundation. And after that,
And then you do the implant.
Yeah.
And so then that artificial bone that you've put in there,
Mhm.
you have to drill a hole down into that, and you mount the new tooth right into that,
So,
correct?
good thinking, but human body is amazing. So that artificial bone that we put in there, it just acts as a scaffolding until your own body fills in your own bone.
Okay.
So it takes about 4 months for that to happen. And the artificial bone that we pack in, it just holds the space instead of letting your natural bone shrink.
Okay. And so once that goes through that process,
Mhm.
when do you put the implant in, I guess is what I'm saying. When do you put the tooth in?
So when the bone is solid enough.
Okay.
So we let that heal also. It's a process, but
And
we
then
want
you
to do it right.
and
yeah.
then you put okay, so once that process has run its course, do you drill a hole in that and put the new tooth in? How does
Yeah.
that work?
So it is all digitally planned. So it is not as easy as just putting a nail in the wall.
But that's
So-
how it mounts. It kind of
Correct. Yeah. In
maybe a
easy terms,
titanium
it is
titanium screw or
there's
something, or-
zirconia, like white implants also available.
okay.
And yeah, it's all guided. I do guided. So we all plan it out ahead of time. So because all the angles matter.
And once and this has gotten so good, the process and all has gotten so good that it really holds up well, correct?
Yeah, it becomes very predictable.
So when you're done, it's almost like as good as new. Again.
Correct. It's
Wow.
amazing.
It's just amazing what you're able to do these days.
Yep.
I mean, because people used to just have these dentures, right, that they glued in, and I mean, my goodness, how far have we come?
Yeah. It just changes the life.
Okay, so when I had an implant, the oral surgeon removed the tooth and put on post in that same visit.
So yeah, so that's great. So that means that you probably did not have much infection and you did have enough bone for them to put that in immediately. So yeah.
Good, good. It is not as easy as putting a nail in the jaw.
Right,
LOL.
Guru, that's what I'm trying to tell him.
Hey, I'm pretty good, with a hammer and nails. I think I might be able to take a swing at that, literally. No, yeah, we probably won't do that. All right. Well, I think we're caught up. I think we're 5:48. We said we'd go for about an hour. Let's do this. Let's show, first of all, let's show your, I don't have your website in a tab there. What was I thinking? Do you have a link from that Instagram page?
I don't think it will work straight. I don't have it.
Okay,
there,
let's get a
but I
new tab.
can-
Let's get your website up. And we'll show that. Here we go. So this is the website, ThurmontSmiles.com, ThurmontSmiles.com. So check that out. And like I say, they're destination dentistry. So folks do travel to come in and have their dental needs taken care of, and it is well worth it. My goodness, you do not want to go to somebody who is, I'll tell you, years ago, I went to the dentist and we were having a conversation and all, and he was talking about, his kids in college and so forth. And when the suggestions that he made and the things that he said I needed and so on and so forth, I said, well, how many of your kids do you want me to pay through college?
Right, I know.
I mean, am I the only one here that is taking care of these college tuitions? When I went to Thurmont Smiles, they were very straightforward, very conservative in their plan that they recommended. They allowed me to have the most critical things done right away, and then later to have some other things done and kind of work through it. And it's very reasonable. The prices are very reasonable, and especially when you see the quality of the work and the work that they do. So my comfort level going to the dentist has gone from about a 0 to at least an 8. I go there a couple more times, I might raise them up to a 10, but I'm very, very critical. So an 8 is a very good rating.
No, that's good. 8 is a good.
Because I started out as 0. So there you go. With my previous.
No, you did great. I give you 8 also as a patient.
Well, thank you.
I'm just kidding.
So here we've got another comment. It takes several months between the post being put in the gum and getting your crown. No tooth for months.
So that's good. That means that they waited for the healing and for the implant to take. And I know it's annoying, but you want to be patient because you want it to last for a long time.
Yeah.
So it's good. It's
and our
done with
WAG
good
says,
intention.
great topic. Thanks to Dr. Mansi. There you go.
Thank you for staying with us.
Absolutely. And now let's show this tab here.
This one?
Yeah. And so that is their listing in the medical department. Well, there's the actual listing right there. That is the listing on Frederick.com that you can go to, and you go into the health medical section, and they're listed right there. And there's a quick link. If you go up to the top of the page, there's a quick link where you click on dental, and that takes you right down this one. And that takes you right down to their listing. And there's also a quick link right on the home page. And then if you click on the home page, we've got them right on the rotator there, the first rotation. You can click on that, and that takes you right to the blog posting. And I think the blog posting is this next tab right here. So that if you scroll down, you can see you're the second blog posting right there. Visions, Extraordinary Eyewear, they're actually going out of business. And so that property is available for lease in downtown Frederick. So anybody that needs a premium location, a spot right there in downtown Frederick, that one's available. So if you click on that, we can show them the blog posting. No, I mean this one. We'll show them yours.
Go back.
And that way we can, what we do a blog posting for each sponsor. If you scroll down, you'll see we've got that photo repeated, and then we've got a couple more photos, and then we've got your description and clickable phone number, and then of course the video that we did. And so you'll want to check out that video also, folks. And let's see here. Blue says, is going to the dentist every 3 months too excessive, or is every 6 months acceptable?
So it depends. We usually prescribe 3 months when someone has gum infection issues, or we have some patients who really like how we take care of them professionally in the office for their hygiene visits. So it is not excessive at all, but it is prescribed based on your needs.
Maybe if they don't floss.
Yeah, that's right. If they don't floss,
come in and let them floss.
Brush.
They'll floss for you, right?
Right. So, yeah.
Now, do you have any patients that come every day and you just floss them every day?
Not really.
You probably don't have that
No.
yet, right? I probably should do that now, but I've gotten, so I'm doing a pretty good job of that. Okay, so I guess we're ready to wrap it up. I think we've covered a lot. Can you think of anything important that we haven't covered about your practice?
No, I just want to say that my whole team, we have combined experience of 50 years. So we really, really want to make a difference. We try to keep you comfortable. I personally don't like going to a dentist myself. So I put myself in your shoes and, we have put in a lot of measures. So it's not too scary for you. And we really want to, if someone's embarrassed by their smiles and they're not smiling, my number one goal is to help you smile more. So come and visit us.
Yeah, I mean, I've been noticing since I was prepping for this show and just going to see you, I've been noticing more and more successful people, they tend to have pretty good teeth.
They do, because that's the
So,
first thing you notice.
I wonder if success and good teeth goes hand in hand.
Because that's the first thing, and you don't want to be judged by your teeth.
Yeah.
And people may think you are not hygienic or you are someone who doesn't take care of yourself. And how would you take care of my business? So
Yeah. So nice meeting you, says Blue.
Thank you, Blue. Very nice meeting you too.
Yeah, and I think that we were able to share a lot of information. I'm just trying to think. I'm just searching my brain here to see if there's anything we missed. Of course, as soon as we hit end broadcast, we'll probably remember something.
That's right.
But I guess,
trying to
I
think
mean,
too.
the key points, the key takeaway here is a lot of the procedures they can do in one visit.
Mm-hmm.
You've got the technology there to get the tooth designed and get that fit exactly correct so that it not only looks good, so that it's solid in place
Mhm.
and they're not going to have to worry about it coming apart and all those kinds of things.
Yep.
I mean, it is amazing to me, the force that your teeth, that your jaw can put down, right? When you're chewing into something, I mean,
Mhm.
it's a tremendous amounts of force.
60 to 70 pounds.
And the fact that you can do the things that you do
Mhm.
and they can withstand
Yeah.
that force is pretty amazing, because you have to not only worry about it looking good, it has to hold up.
It has to hold up. Yep.
And
Yep.
and
That's
so-
why we base it on oral wellness, and we look at everything, your nutrition, your pH in your mouth, how much force you are putting on your teeth before we start designing the smiles.
And you can look and you can see, like, if they're rubbing their teeth at night and
Yeah,
all that, and you can
absolutely.
give them a device to put in their mouth.
That too, and we ask now, the latest science is showing that it's happening because of sleep apnea.
Mhm.
So I recommend that they get tested that first before we put a Band-Aid on their teeth. So, yep.
Yeah.
It's all
So-
connected.
So let's see. We do have one more here from our WAGs. I've always wondered, who does the dentist go to for their dental care?
Good question. I used to go to Philadelphia because it's very important to me to know the mindset of the provider, and I want to feel that they are doing it for me and not for themselves. So I used to go to the doctor who trained me. I was trained at 2 dental schools actually, but one was in India, one is in Philadelphia, University of Pennsylvania. And the doctor who trained me, I used to go to him. And then later, just fairly recently, a few years ago, I switched to my friend who just moved in here. We were in the same group and trained by the same doctor, and she's like my clone, so I trust her.
Well, there you go. And
she's closer.
Does she operate in Frederick County?
No, she's in Virginia, and she
Virginia,
moved
okay.
further south, but
Okay.
she makes me feel comfortable. So
Well, like I say, I mean, this is one thing that it would make sense to travel. I mean, you're only doing it every 6 months. And if you have to go an extra hour down the road, or even an hour and a half down the road or whatever to get it done right,
yeah,
that's
so
nothing.
important. It's so important.
That's nothing. So folks, if you're in the Mid-Atlantic region, come on in. This is a great place to come to get all your dental needs taken care of. And Thurmont's a great little town to visit. Dr. Mansi, you're very modest, Ivy League educated. There you go.
Oh, thank you.
There you go.
Thank you. It just means that I want to do things right. That's what my education has taught me. So yeah, thank you for your kind words.
Well, and you are a detail person.
Yeah, well, they would kill us at the Ivy League University if we went like 0.001 millimeter off. So
Yeah.
and my mom, right from the beginning, she also trained me to be a perfectionist in a good way.
Yeah.
So
Yeah. Well, you're doing something that is very important.
Correct.
So thank you very much for taking your time. I know
Thank you for having
you're
me.
exceptionally busy. And let me put up your URL here also. Let's see, we've got banners, and we've got this one right here. So we'll put that up in big letters. And of course, we got another comment. We're getting ready to wrap up and say, so Kyle's in the house. Kyle, you're
Hello,
late.
Kyle.
You're late. We've got 1 minute. Do you have a question for the dentist? Do you have any dental questions? Kyle's a good-looking guy. He's in California. He's going to be coming to visit also.
All right.
And he's also thinking about moving to Texas. So Kyle Jett in the house. Do you have any question regarding dentistry? And we can answer that. But otherwise, we're going to wrap it up. And thank you for coming in. And ThurmontSmiles.com, ThurmontSmiles.com. And they're just saying hello to everyone. Well, you guys are saying hello to everyone, and we're getting ready to wrap up the show. So, okay. Well, that's it, right? We done?
That's it. Yeah. And reach out to me if you're late here. If you have any questions, I'm always available. You're seeing my Instagram there, Thurmont Smiles, and just DM me. That's the easiest way to contact me.
And he's thinking about Florida also. So yes, Florida's.
He wants good weather.
Go to Florida, not Texas. Okay. So what we're going to do to wrap this up, let's see if we can do this. Oh, no, another comment. Come on, guys. I'm looking for a new dentist, actually. Well, Kyle, this young lady can take care of you, because I'm telling you, she does it all right there in the office and does the best job. So road trip, and you can stay here while you're getting it all done. Okay. I'll give you free lodging.
There you go, Kyle.
How's that?
And we welcome you.
So let's see. Let's play your video. I think we've got your video in here. The one that I did. Let's play this, right? Is that it? No, that's your picture. Oh, your video's not here. Maybe it was too long. Is that it? No, is that it?
No, that's just
That
one is 3 minutes.
Maybe this is.
Hi, I'm Dr. Mansi Oza. I'm a general dentist, the owner and the founder of Thurmont Smiles Dental Practice. We are located in Thurmont, Maryland. So we work with people who are embarrassed about their smiles. Maybe their teeth are chipped, or they are worn, or they are misaligned, or their color is not good, or they have gaps in their teeth, but they have stopped laughing or even smiling because they feel conscious about their smiles. So with our holistic oral wellness approach and utilizing our high-tech advanced technology, we create custom-made smiles for our patients. They not only smile confidently, but their whole life changes, and they start laughing with all their heart. And I'm able to do this with the help of my amazing team members. We all have a combined experience of 50 plus years in dentistry. They come in every day and they live my vision. My vision is to make a positive difference in our patients' lives. We literally bend over backwards to keep our patients comfortable. We have overhead TVs in our operatories. We have soft neck pillows, lavender essential oils, and I offer sedation dentistry. We offer a wide variety of dental treatments, including dental implants, Invisalign, cosmetic dentistry, and our patients really love our CEREC one-visit dental treatments. So we are able to now provide porcelain restorations in just one single visit. It used to take us 1 whole month to get the restorations back from the laboratories. I'm able to design the porcelain restorations right in front of our patients. You are able to see the whole process, and it is so cool to be able to give you just restorations in just one single visit. No numbing twice, or no waiting, no temporary crowns, no goopy impressions. It's truly amazing. I do understand that the dental treatments are expensive, so we offer very flexible financial options. We also have our in-office dental discount discount plans for patients who do not have dental insurance. Ultimately, my vision is to help our patients smile confidently, eat comfortably, and live healthfully.
If you own a local business, please join us.
All right. Well, thank you everybody for watching. I'll check
Thank
the
you.
comments one more time, and then we're going to wrap this puppy up. He says he wishes that your office was closer.
You can come to us.
Can I melt down a link from my day date and turn it into a gold tooth? So gold, can you take some gold that the customer supplies?
We can try. I've never done it,
We
but I'm
can-
sure it's possible.
We could certainly give it a shot. All right, everybody. Thank you for watching, and thank you for coming, Doctor.
Thank you
And
for having
we'll
me.
see you all next time.
Take care.